Multidisciplinary Autism Consultation Clinic, a novel approach to access to specialist care. This brief presentation aims to provide an overview of the project done by those whose names are listed, aimed to describe the consultation clinic model being used here in Birmingham, Alabama. Autism spectrum disorder, or ASD, is a neurodevelopmental disorder that presents significant diagnostic and management challenges for families and providers in community settings. Most primary care providers have limited training and experience in diagnosing and treating autism, which often requires comprehensive evaluation and services found in specialty clinics. To our knowledge, this Multidisciplinary Autism Consultation Clinic, or ACC, is the first of its kind within our state to provide an avenue for outpatient consultation specifically catered to the screening and treatment of ASD. This clinic is designed to be a time-limited, brief service which involves screening and triage of autism symptoms to determine if a comprehensive autism evaluation is needed, as well as provide targeted consultation regarding challenging behavior and brief medication consultation for most complex cases. At the conclusion of 4 visits, referral back to a provider for ongoing treatment is made. In order to determine the effectiveness of this project, we will first ask patients and/or caregivers to complete several validated rating scales at the initial visit to establish baseline symptom burden. After determining the needs of each individual case, each patient will be triaged into one of 3 services provided in the ACC: autism screening, short-term medication consultation, or brief behavioral consultation. At the final visit, the validated rating scales will be completed and compared to the initial visit scores for our primary outcome data. Our goal is to efficiently provide families with access to high-quality specialist care and to provide direction to their continued treatment in the community. In many states throughout the USA, including Alabama, a shortage of child and adolescent psychiatrists experienced in managing ASD has caused challenges in access to quality and effective care in the community. Creating efficient avenues to access to care is imperative. Our goal is to provide easy access to short-term outpatient consultation with a specialty psychiatric clinic. The 3 major pathways in the ACC include 1. Screening for ASD concerns, 2. Behavioral consultation, or 3. Medication consultation. Our clinic flow is illustrated in this flowchart, with the first branch point being whether or not an autism diagnosis has been previously made. I encourage you to take a few moments to follow the various pathways of this chart and see how screening for ASD, behavior therapy consultation, and medication consultation are addressed within the model. In Table 1, you will see demographic information for referred patients up to the point of this presentation, although patients continue to be referred. Our results show that the majority of patients referred for screening do exhibit features concerning for ASD. Additionally, the validated rating scales completed during initial visits yield higher than average percentiles, indicating substantial symptom burden. At the time of this presentation, we have 36 referrals to be seen for screening, behavioral therapy consultation, or medication management consultation, demonstrating the need for this clinic. In conclusion, in appraising the challenges faced by primary care providers, parents, and others involved in caring for patients with ASD, combined with the shortage of resources and specialty care options in our particular community, we endeavor to find a highly effective and beneficial yet practical solution. Our goal is to evaluate need, triage appropriately, and make short-term interventions in addition to establishing comprehensive, long-term plans and goals for treatment. The frequency of these referrals from the community underscores the great need for psychiatric assistance. The short-term consultation model provides opportunity for constructive interventions while maintaining provider availability for subsequent referrals. As more patients reach the completion of the consultation process, more outcome-validating scoring measures will be available to ascertain the effectiveness of this clinic model. I'd like to acknowledge and thank all the participants and staff who contributed to this project, including all those named on this poster. In particular, I'd like to thank Dr. Irina Bukelis and Dr. Roland Pixley. This has been 4th year medical student Michael Matthews. Thank you for listening.